And I do just want to first thank the Obesity Society and the Lipedema Foundation for inviting me here today to share my patient perspective. It was actually 10 years ago this month that I attended my first, it wasn't at the time the Fat Disorders Research Society, it was just a group of women with lipedema who were going to get together because the previous year a small group got together. I think about 15 had gotten together in San Diego, and the next year in 2013 in Tucson, they expected about 50 people to get together, and it turned into about 100 people. It was my first time I had ever met another lipedema patient in person. At that time in 2013, I had already began advocating for lymphedema, because that's what I was initially diagnosed with, and obesity, because I certainly had both. And I understood the importance then of connecting these two communities together. And so it means a lot. This seems like a decade of waiting to have this happen today, and I'm so glad to see the turnout. I'm going to share with you my patient perspective. I pretty much checked, I think, all the boxes Dr. D said. Growing up with obesity, I never had many expectations placed on me. You know, most people thought I wouldn't do much. I am definitely an overachiever, and as Dr. Dean expressed all the signs and symptoms in the late stages of lipedema, I'm certainly an overachiever when it comes to that. And they say pictures are worth 1,000 words, and as we already know, there are no diagnostic tests for this. You need to know what you're looking at. And so I have collected several photos of myself throughout the years. And just to note, I'm the youngest of 5 children. My mom had told me that I was actually her lowest birth weight child, around 8 pounds. I don't know all the other ones. And interesting to note, because of the research regarding breastfeeding and childhood obesity, I was the only child that my mom breastfed. So that doesn't necessarily pertain to that. And that's, again, a picture of me on my 3rd birthday, looked relatively normal. Those are 2 cousins who are born within the same month as myself. And I just got this picture on the end last year. My cousin sent it to me. And, you know, I always look at my legs in pictures. This is the first time I really kind of noticed something in my arms. And my siblings used to tease me. Of course, I'm the youngest. They teased me a lot. That they used to tell me that I just never lost my baby fat. And sometimes I think that might actually be what happened. So going into kindergarten, you can see there, I think, I mean, when I look back at it, it looks to me like you can see the difference in my legs, especially the middle picture again. So those are all my siblings, and then the cousin who's a month younger than me. And so I just certainly look and see the difference in my legs. And then especially the one on the merry-go-round, I think when I look at it, the difference between my upper and lower bodies. And just back to the age 7, it was in 2nd grade that a school nurse pulled me out of class to let me know that I was fat and that I should do something about my weight. I never thought I was any different than my friends before then. So the thing was, at that school, we had to take whatever, like, if they were feeding you 5 dishes at lunch, you had to at least take 3. In order to get excused for recess, you had to finish a certain amount of your food. So of course, I loved recess. I was an active child. I liked to ride my bike. I liked to play tag with my friends. So I was a child who did what I was told. So I ate what I was told, and I went out to recess. So probably the 2nd or 3rd week, the nurse pulled me in, and I don't remember. I remember at the time I weighed 125 pounds, but I don't remember if I had gained or lost or hadn't done anything. But the nurse asked me what I ate, and I told her, you know, what I had for lunch, and there was a fudge sickle that day. This wasn't an instance of me taking extra money and buying extra snacks. It was part of the food, the menu. And so this nurse looked at me and said, if you're not going to take this seriously, let's not waste our time. And I said, okay, let's not. Because, I mean, even at 7, I thought, again, I didn't know, I just was myself. And honestly, that's what I've tried to be all my life. And then there was a time when my mom had put me in a 6-week childhood nutrition class that was sponsored by the hospital. And she later told me that the organizers and the people who ran that program told her I would never lose weight. And I said, why did they tell you that? And she said, because they said it didn't bother you enough to lose weight. Looking back, I can remember the tips they told me, drink white milk instead of chocolate milk. I already did. Have salad with your lunch. Of course, it was public school, so it was depending on what was provided. But some of the tips they told me were things I was already doing. So I kind of can look back in an early age and know things just were different about me. So going on into middle school and high school, again, I rode bikes, I walked to school, and I had a paper route also. So every day, 7 days a week, I delivered newspapers. So it wasn't that I wasn't being active. It wasn't that I was being lazy. I was in the high school band. My senior year, I got a job at Taco Bell. So I was very, on my feet, working. You can see, I think I can see in that age 15 picture, the knees, and the way the knees are going back. And then, of course, I graduated. By the time I graduated, I was over 400 pounds. I had never tried, my mom would take us to exercise at a gym, or my aunt would have like one of the, I don't even remember the name of it. We didn't have like Weight Watchers and those types of programs in my town, nor did I have the money to enroll in any of that. I can't remember doing Richard Simmons programs and things like that, but I'd never really tried a lot of, to me, would be, like get then quick things for several reasons. One, telling me I could lose 10 pounds, I needed to lose a lot more than 10 pounds. So none of those things really interest me at that time. So after high school, I did go on to college. I went to a local state college. I was very active in student activities, student leader. So this is 5 years after I graduated, but this is 1 month before I turned 23. I just turned 46. So it's been half of my life that I've been trying to save my life. It was in this month that, so I went to college. I didn't finish my education due to difficulties getting to class because, my weight was escalating. I went on Social Security disability this month and Medicaid. And so I say it's my lowest point because I hit rock bottom. And, they say there's two ways to go, straight up or sideways. I went sideways for a while, I'll be honest. This is my best friend from college. She was concerned about my legs, concerned about my, the lack of mobility, the losing mobility, which was true. But I had actually gone to a doctor that April of 2000 because I was also scared about my weight. And so I know I'm kind of jumping around. So this is just looking back to, October of 1996. I was obviously had obesity, but I had large legs, but I had normal legs. Those shoes that I'm wearing are actually like anklet boots. So I was able to wear, something on my ankles. And then just 5 years later, that was the picture taken. So I initially went to a doctor in April of 2000. She told me that I did have fluid in my legs. She didn't say it was lymphedema. She just said fluid in my legs, and she said it was just because of my weight. And I just needed to lose weight. She didn't give me any additional, she did offer bariatric surgery at that time, but with my age and the fact that I knew I hadn't tried a lot of things, I wasn't interested that much. She handed me a diet. She didn't even know what my weight was. I eventually asked her to send me to a physical therapy so I could get like monitored exercise. And I was able to get into the pool. So there was a therapy pool, and then I would walk in the regular pool. And I actually met another gentleman there who said he had lost weight, and I asked him where he got weighed, and it was a junkyard. And so I found out my highest weight by going to a junkyard in my small town because there was no scales available at the time. And so at one time I had a sore on my leg, and my primary care doctor sent me upstairs to a surgeon. And the surgeon, thankfully, I didn't need any surgical intervention to the wound, but he put me on Coumadin because of my legs and my risk of blood clots. Looking back, he didn't do any blood work. He didn't do any monitoring. He just put me on Coumadin. So I had a primary care doctor and a general surgeon who were missing this painfully obvious condition. The silver lining to that is the Coumadin made my periods very heavy, and I needed to go to an OBGYN. My sister had just given birth to my niece, and she was friends with her OBGYN, and I thought, well, this doctor would probably be nice to me. So I saw her, and the first thing she asked me what my doctors were doing for my lymphedema, and I had never heard the word before. And I said, please send me to a specialist. And I was living in Ohio at the time, and I asked her to send me to Ohio State. It wasn't Dr. Dean at the time, it was another doctor. But that picture was taken the day I was diagnosed, and I look at it and I see the small feet that were not affected. My leg drugged the ground. I would usually have to wear shoes that had a little bit of a heavier sole on them so that my foot didn't touch the ground. I was mobile, and I'm not really quite sure how. But it just took someone who knew what they were looking at to diagnose me. Now, again, though, I was only diagnosed with the lymphedema at the time. And I was able to get treatment. I started just with a pump, and you can see with just treating the lymphedema, the results I got. The last picture was the first pair of garments I got after doing the conservative treatment of compression pumps and then MLD and compression wrapping. And now I'll finally get to having lymphedema. So again, I was initially diagnosed with lymphedema because I was on Medicaid and I was able to get the pump covered. I asked the doctor how he got the pump covered. He gave me the information for Medicaid, and I made the decision to have bariatric surgery because when I weighed myself at the junkyard, it was an eye-opening because I'd been trying to lose weight, and if I was at 500 pounds, and I thought, okay, if I've lost weight and I'm still over 500 pounds, I need more help. So these are pictures of me. I'm in Florida, so it's about a year after surgery. But I'll have to say, having lipedema and going through bariatric surgery, the expectations that were placed on me for my weight loss after surgery and the fact that I didn't meet those expectations, my surgeon was under, we didn't know what was going on, but I wasn't shamed that much. I was shamed more when I got a new surgeon in Florida. But it's a real struggle because, of course, my body wasn't reacting the same as other patients. I was told I would lose 100 pounds within 4 months. And it took me, I think, 8 months to lose 100 pounds. And then after about a year, I kind of plateaued off, and I wasn't losing anything. When I saw my new surgeon in Miami, she was very, why are you regaining? And I had to explain to her I just had stopped losing. But it was because of the weight loss surgery that you could really start to see the difference between the lower and upper bodies. And of course, my arms, everything are affected. And so then I had reconstructive surgery to remove the excess skin. So this was me, at my best, at my lowest. The picture in the middle is actually what I took because I was pursuing brachioplasty. We'll get to the next slide to show everything I've tried to do to combat these diseases. And then the end, the cousin who's a month younger than me. So she's not affected. I am the only member of my family who've gotten this advanced stage. I think my siblings maybe have an early stage of it. I do have another sibling who underwent bariatric surgery, and she's maintained after that. But I'm the only person who got up above 350 and into the 500s. And again, so these are my legs as I started to regain weight after my lowest. And you can see I maintained the lymphedema pretty well, but as you can see, the thighs. And what from my perspective is I lost any typical obesity tissue, and what I've regained, it was replaced with lipedema tissue, which makes it even more difficult to lose. So here's the treatments. So again, I was diagnosed in December of 2001. It took until March to get everything approved. So I started using pneumatic compression pump in March of 2002. In August of 2002, I began MLD and compression wrapping 3 times a week. It was in April of 2003 that I had a distal Roux-en-Y gastric bypass surgery. Again, as I mentioned, I kind of plateaued after that. I was put on, I don't even know how to pronounce this correctly. Is that topiramate? Okay. I did have so I was about 330 pounds. In order to have the paniculectomy, my doctor wanted me to lose more weight, so it did help me, but I was also working a second job at the time, a retail job, so I was a little bit more active, but I think I lost about 60 pounds on that. I had my paniculectomy and a hernia repair and was doing very well. I had brachioplasty twice, and just to understand we're up against, my arms are bigger now than they were before. There's something we have to figure out to turn off the switch of the lipedema because this tissue just keeps coming back. In August of 2010, I had a revision to my gastric bypass surgery. I was having not just regain, but I was also having acid reflux, and I had a hiatal hernia. Then in April of 2021, I started taking semaglutide, and I am still currently taking that. So this is just a chart. You can see the changes in my weight. I know it's a little bit difficult. There was a point in time where my mom said the pediatrician told her I gained 40 pounds since my last visit. And I said, and that didn't tip anyone off. No one questioned what was going on. But of course, that many years ago, there wasn't anything known. But what's interesting is between 2014 and 2015, I actually had almost that same amount regained. And I do not know what the reason was for that. I can't pinpoint anything. Another interesting point is Dr. Dean had mentioned usually puberty or other like pregnancies, spur lipedema. I obviously had signs of it before puberty, and I've never been pregnant. And so something within my genetics or my system has gotten me to be the overachiever without any of those milestones. And I will say I've been on the semaglutide. As of last year, I haven't had any change in the past year, although I have met the expectations of that. So just because I've talked a lot about my health, so overall, metabolically, I'm fine. You can see I pulled up my A1C is always been good. My cholesterol is good. I do have mild sleep apnea that I do use a CPAP machine, but my CPAP is like setting of 5. I mean, it's very mild, and we had the option to whether to treat or not to treat, and we just thought for long-term health, it was better to treat. I am hypermobile. I have not been diagnosed with Ehlers-Danlos because the geneticist I saw said my extremities were too large for her to give me a physical examination. Interesting things. So when I moved to Miami and I found out I had lipedema, and I thought losing at least the weight from bariatric surgery, everything was going to be great. I ended up I get cellulitis a lot because of the lymphedema. And I had a DVT that led to, this is where I love and this audience probably knows most of these. So I had a DVT. A couple months later, I had my first of 2 TIAs, and then it was discovered that I had a PFO. And I also have another congenital cardiac abnormality where I have a persistent left, absent right superior vena cava. So I do have some, other cardiac things that might go along with Ehlers-Danlos. But again, I haven't had anything officially. But otherwise, normal blood pressure. And my biggest concerns about my health is my mobility and the frequent cellulitis, which have improved over the past year. But, with cellulitis, you get very quickly go septic. And with the weight bias in healthcare, I just get very concerned about that. So just to kind of wrap up my perspective as a patient, I feel like I've been robbed of my life by this disease. I've never been able to have a full career because of the complications of more so the weight bias of lipedema. I've twice been fired due to weight bias. Then having the inability to stand or sit for long periods of time, frequent cellulitis, it just makes some jobs very difficult to do. I want to be believed. I'm tired of being called a liar or labeled non-compliant. I mean, especially when you're trying different obesity treatments and you're not meeting the expectations that the treatments have. I thought like my food journals were lies, because it just didn't make sense. If I was actually doing something, it didn't make sense. I want to be able to advocate for myself without my intelligence being questioned. There's a huge stereotype that people with obesity are ignorant, because if we were smarter, we would take better care of ourselves. And as you can see, I have been trying to do as much as I can for over 20 years. And, of course, it's also difficult with having a disease that doesn't have a diagnostic test. And, I've also often been told I'm just using a made-up internet disease to make excuses on why I want to not lose weight. I want to be able to get recommended screenings, tests, and procedures. Lipedema isn't fatal, but I have several friends who have passed away from lipedema because of their inability to get care for other diseases, specifically cancer. Many MRIs and CAT scans have weight limit capacities or their size are limited. And just currently, I can't get a recommended breast MRI because the machines do not accommodate my size. I get the mammogram, but, it's interesting because we're often told that having obesity increases our risk of developing cancers, and yet we can't get the recommended screenings, let alone if we actually were diagnosed with something, be able to get the treatments we need. I'm tired of having to prove myself worthy of health care and of existing, and this ties into, I recently just got one bill passed for treatment of lymphedema, and of course you have to prove covering the cost of care is economical, there's a cost savings to it, and now I'm doing the same with trying to get obesity care. We don't do that for other diseases. The care is just covered. And then again, lipedema or obesity, because people often, my friends who have had bariatric surgery like to say, well, Sarah, you have lipedema, it's not the same. And my friends who have lipedema say, this isn't obesity, this is different, we're not to blame. And I say, well, people with obesity aren't to blame either. Because in my perspective, my struggles have been the same, and I've been treated or mistreated the same way, rather, if it's lipedema or obesity or both. So my wish as a patient, I wish there was a diagnostic test for lipedema so it would be believable. That's another challenge. Growing up, whenever I had my metabolism was okay, my thyroid was okay, any other test that you would typically think, might be a cause for a patient to, gain weight or, regain weight, those were all normal. It's just because there's not a test that exists to test for this. A genetic test, so you might know if you're predisposed to developing it later. And effective treatments for lipedema, including advanced stages. We currently have some surgeries available to us, but many of the surgeons still have a BMI limit for those patients. And you have a BMI limit on a condition that the patients struggle to lose weight. So it's just, it's frustrating. I want doctors, and that's why I'm so thankful to be able to be here and to have this presentation here, because I guarantee any of you who are treating patients with obesity are also treating patients with lipedema. You just don't know it yet. But we need doctors to recognize the symptoms early so that no one advances to that late stage. And I want more research to the causes of lipedema. I really think understanding lipedema tissue can help better understand obesity. I often find that doctors within the obesity community, they're not as concerned with me because I'm metabolically healthy. We're looking at trying to improve, heart disease and high blood pressure and all the metabolic conditions that go along with obesity. So when they see me and they say, oh, well, you don't have diabetes and your cholesterol's great, you're good, but I'm not good. When my mobility's at risk, and I'm not able to get screenings, and I'm not able to get heart procedures because of my size, I'm not good. But maybe there's some key within that lipedema tissue to help understand what the misfunction is in the obesity tissue. Obesity treatments that focus more on just reducing caloric intake. We know obesity isn't, the cure isn't just eat less, move more, yet most treatments focus on reducing caloric intake. Even the semaglutide is said, it helps people control what they're eating, but it's doing something else. And I never thought I would, after bariatric surgery, of course, I was never perfect growing up, but after bariatric surgery, you learn more habits. So it was never that I thought I was not eating well. It was just my body. There's no way I eat enough to maintain this body size. So if we can look at something outside of that, of how the body is processing that versus the patient intaking less. And just finally, for doctors to listen to patients and to learn about their other health conditions. You don't need to be a specialist in this, but you need to be able to recognize it and refer patients to someone who can treat them. It's the same if you had a patient with diabetes and they saw an endocrinologist, but you still understood it. You still kept track of that. We need this, and we need it, especially when patients go into the hospitals. A little off topic, but we need a chronic condition like lipedema to be understood in all areas of care. And I just want to finally, people often ask, is this genetic? Has anyone else in your family been diagnosed with it? And this is just a picture of my mom. And I think, yeah, I think you can kind of tell that's genetic. She was, I think, never like officially diagnosed with everything. But, and just to wrap up, because, I kind of feel like if I would have known in that picture of me at Halloween that I had lipedema and I could have started wearing compression or started some of the conservative treatments, my legs never would have got to the point of having advanced stage lymphedema also. And that damage just is irreversible. I mean, I can treat it, but the damage has already been done. And I know I can't change the past, but I'm here to help, change the future for not just for myself, but for other patients.